Hey, LinkedIn, and welcome back to Business Unusual. This is a live show brought to you by the LinkedIn News team, where we're talking about as a community about the changing nature of work. I'm Caroline Fairchild, editor-at-large here at LinkedIn, coming to you from my home office here in New York City. When we talk about startup survival, pivoting is often necessary to continue to drive profit. But what if you had to pivot your startup not just to continue to stay in business, but to potentially save lives amid a global pandemic? In the race to come up with solutions to the coronavirus, startups are playing a critical role, whether it's hospital and medical technology, supply chain solutions, or telehealth providers. In many cases, the nimble makeup of startups have allowed them to respond more quickly to this crisis. On today's show, we'll speak with the founder of the first startup to announce an in-home testing kit that it developed in just 2 weeks. EveryWell founder Julia Cheek will join us on today's show to discuss how she has shifted the plan for her startup amid the pandemic and what she sees as the path forward coming out of it. But before we bring on Julia, I want to hear from you. The whole point of this show is to have a conversation as a community about how the coronavirus is impacting the ways that we work. If you're in the stream right now, thank you so much for joining us. Say hello to your fellow members in the stream. Let us know what's going on the ground for you. Are you returning to work right now? Are you still working at home? Are you a frontline worker who has been in the office this whole time? Share your insights in this stream. And if you have questions for Julia about how she's managing her business during this time as well, please be sure to put those in the stream and we'll get to them later on in the show. And with that, I want to bring on EveryWell founder and CEO Julia Cheek to the stream. Hi, Julia.
Hi, Caroline. Thanks for having me. I'm excited to be here.
I'm excited to speak with you as well. Thank you for doing this. Let's go back to the beginning of this pandemic because EveryWell's response was so rapid. Talk to me about that first moment when you realized that you needed to shift some resources to start developing this in-home testing kit.
Yeah, for us, it started actually back in January, end of January, early February, as our chief medical officer was watching the spread of the virus abroad, and then really started listening to what the FDA and the CDC were sharing about testing constraints, which started to surface towards the end of February. And so by early March, we had already announced a grant program for smaller labs that wanted to apply for the FDA's authorization for COVID-19 testing as really a way for us to support the testing capacity and get involved, not necessarily for EveryWell ourselves to throw our hat in the ring and help actually drive testing throughout the nation. And so it really wasn't until mid-March until we as a team came together and said, there is so much demand from these labs to be part of the solution. We have a technology layer that connects with labs and allows for national distribution. We have an imperative, really, a vision and a mission imperative to be involved. And so it was that moment that we really started marshaling our resources toward what became a healthcare provider testing launch first, and then, of course, the later consumer launch in May.
And when you first released these testing kits, the testing situation in the US was dire. It was really challenging to get tested for COVID. What was the customer response? And in turn, how were you ensuring that the tests were going to be accurate?
It was an overwhelming response. And we benefited from some of the good news stories coming out around that time about companies responding, not just EveryWell, many companies responding to the pandemic in different ways, whether it was PPE or testing, et cetera. But with that attention came tens of thousands of individual requests from frontline workers, from healthcare professionals, from individuals who either for themselves or their families were desperate to get access to a test. And so it not only bolstered our commitment and resilience toward our role as part of the solution, but it also, frankly, was very heartbreaking. And we, ended up, we had already committed some of our inventory to frontline workers and ended up amidst a number of different factors, pivoting our whole inventory towards healthcare providers for a couple of months. And ultimately that was the right call. And we're happy that we did it. We've distributed upwards of 100,000 tests now. And it's been, I think, a small way, but a small part of the solution in being very fast to get people access to testing. That's something startups can do really well. But it was really in response to this just tremendous and overwhelming demand from individuals for these services and a feeling that we needed to respond.
And for those of you who are just joining the stream, this is Business Unusual, a live show where we're talking about the changing nature of work. I'm here with EveryWell founder and CEO Julia Cheek. We're talking about her company's response to getting in-home testing kits to frontline workers, to customers around the COVID-19 crisis. I want to say hello to some members in the stream right now. Joyce from Ohio, Alfred from California. Welcome back, Alfred. Naomi from Maryland, and Danielle from Las Vegas. Thank you for joining us on today's show. If you have questions for Julia, leadership, management, she has young kids at home. So if you want to talk to her about that, let us know in the stream, and we'll talk about that on today's show. Julia, you talk about getting these kits in the hands of frontline workers during a really critical time. In order to do that, it required some policy work on your end as well, where you're taking some trips, maybe virtual or not, to Capitol Hill. Talk to me a little bit about that work and how it was essential to getting these tests to market.
Absolutely. So in the course of announcing our test, a couple of other companies launched their test, and then the FDA very clearly made a statement that they said, wait a minute, we have not actually considered, we believe in at-home testing, but we have not considered that path yet, and we need to do more work here and work with test developers before we decide to authorize this. And so, we of course were already working with healthcare providers and have continued to scale that. And then we began a 2-month process in partnership with the FDA, as well as working with Congress to educate them about what our offering was, to then work with the FDA, provide data, work on a path, and become the first company to get an EUA of our kind, which is a broad umbrella authorization for an at-home testing collection kit where many labs can be authorized under our home kit. And I think that's a really important point as we think about the capacity problem that we're trying to solve, both as we go into the second wave and then into the fall virus season. So we have been really proud of that work, and it paved the way for a broader path for any company to be able to do this. And we were on the forefront of doing the work with the FDA. Now, we also spent time getting to know our congresspeople. And so talking to them about the benefits of home testing, why this was going to matter today and in the future for COVID-19 and otherwise, and also talking about the cost of COVID-19 testing. There is a bit of misinformation around the fact that this testing is fully free, and we're now hearing reports from people getting hit with other medical bills related to their hospital stays or to their testing. Shipping is not covered. Some things are considered medical expenses, some aren't. And so we're working with Capitol Hill now on how can we be part of the solution to get all testing materials and costs covered. And that will benefit everyone. A lot of the work we're doing is, yes, of course, in service to our mission and our company, but also more broadly to be part of kind of accelerating the testing response more broadly around the country, because this is here to stay for likely, at least several months, if not a couple of years.
And you mentioned working with the FDA as you work to accelerate the rate in which people can get tests and then also receive the results. FDA guidelines are constantly changing, which I'm sure it's hard to work in tandem. What has been the biggest challenge in terms of how the FDA has been updating guidelines that then you have to respond to your product with?
Especially back in February and March, the guidelines were changing, or were updated rather, as often as multiple times a week. And for a company of 80 people, that is a lot to adapt to. And our goal has always been, obviously, to be in accordance with what the guidelines are. But the guidelines, as you've seen from PCR to antibody testing, have shifted quite radically. And so we had to stay flexible, stay adaptable, make sure that on a 24-hour basis, we were making sure we were compliant. And I think that is some of the benefit of being a startup in this environment is we had to make a culture shift and just say, this is the moment, this is the opportunity for EveryWell to have a real platform for our services, and we're going to seize that. And for this short period of time, we're going to accept that it is going to be a world of change. And that, I think, is really important from a leadership perspective, is one, it's temporary, but two, in order to add value in this pandemic and to help people, we have to be responsive to the regulatory changes. And we've learned so much about this virus, and that has kind of caused the regulators to have to make all these rapid updates. They've worked faster than I think they've said they've ever had to work. And then that means companies have to be responsive as well. So I would actually frame it now as a great partnership. And I think that it is a challenge in healthcare to be that adaptable, but it's also a silver lining to see how quickly not only the FDA, but other laws have been changed in healthcare that had taken decades to push through around telemedicine and otherwise. So I'm actually hopeful that this pace will result in some good outcomes for the future.
And in a way, the industry of in-home testing is a big part of how healthcare is changing right now and how consumer behavior is changing around the ways that they can get healthcare solutions. But there's still a lot of concern around, am I going to get a valid test? Am I able to administer this in my home? Particularly to the COVID test, which, you kind of really have to know what you're doing up there with your nose in order to get a valid sample, I'm sure. How are you addressing that with, say, the materials that you're giving to customers and making sure that when they're investing in this, they're getting something that's valid coming out?
Yeah, it's a super important question, and I think there's a few points of clarification for what all of the at-home approved PCR diagnostic tests are. I should say at-home authorized by the FDA. These are all short nasal swab collection or saliva. So what that means for short nasal swab is this is a swab that you put about an inch into your nostril, in each nostril, for about 10 seconds and twist it around to get a good sample. And there have been multiple studies that were used by the FDA from United Health Group and Gates Foundation and otherwise that published around COVID-19 showing that self-sampling in this format was as accurate as healthcare provider collected sampling. Now, of course, there were other areas of self-collection at home that needed to be validated with data, which is transport, stability in transport, stability at different temperatures, and how quickly that sample could be processed and could consumers follow the entire process accurately. And so we've been submitting data to the FDA just to show how well and how successful our customers have been in sending their packages and their samples in correctly and accurately. Now, of course, and there's been a lot of press on this, with RT-PCR testing, which is the diagnostic testing for the presence or absence of the virus that causes COVID-19. There is a chance of a false negative, right? The chances of that range roughly, it's about 3%. And we see roughly the same amount of false negatives expected from our labs in the data that they submitted for their emergency use authorization. And so that is really related to when you collect your sample in the virus's life cycle. It's similar to when you may get a false negative on a flu or on a strep test. It's the same implications there, and it's not going to be perfect, but the process itself is really simple. It's just as accurate as if you go into a clinic and have a healthcare provider collect it. And it's a much easier way to stay isolated at home.
And of course, EveryWell was around before this global pandemic. What drove your initial passion to start an in-home testing kit startup?
I think you mentioned just the relevance of at-home testing now. And this is a mission and a message that we've been on for 5 years now, serving nearly almost 1 million people across all of our clients, across our .com business, and our retail partners and our partners like CVS and Kroger and Target. And we've been able to bring critical testing like STI testing, cholesterol, hormones, diabetes, et cetera, into the home for people to do conveniently, affordably, and with access to digital results that they use with their physicians. And so this to me is a moment of validation around why convenient home services matter in healthcare access. They matter for people who can't take time off work, for people who can't drive to a facility to get treatment, and for people who may be underinsured and need to know that they can get a test that's only $49 and they're not going to get hit with a surprise bill. And so I am sorry that obviously the pandemic was the source of creating the education around home testing, but we really believe, along with many other companies, that home testing will be here to stay as telemedicine takes hold and as we've all seen just a radical increase in demand for our core services, both from healthcare providers and from consumers alike.
I'm seeing a ton of members just join us in this stream. If you are just joining us, this is Business Unusual, a live show where we are talking about the changing nature of work today with EveryWell founder and CEO, Julia Cheek. If you have questions for Julia about her startup's response to COVID-19 or any leadership lessons that she's taking away of running her 80-person company from her home, let us know in the stream and we'll get to those questions on today's show. I'm seeing some questions right now from Nora, Jules. We'll get to those later on. Julia, 80 people, you're at home, you have young kids, at least one young kid. How many kids do you have?
One young kid, 10 months.
A 10-month-old baby, 80 employees to take care of, all remotely. What has been some of those challenges, and how has your leadership style had to change amid this pandemic?
You know, I've been in the moment now. I've had maybe a couple weeks now to take a step back. We've been pretty 24/7 since March for the last 3 months, and you know, it's so hard. You want to be proactive and you want to be thoughtful and empathetic. And yet I think much of leadership in the last 3 months for so many different leaders has had to be reactive, making the best decisions for your employee base based on constantly changing factors. And, you know, I think for me, what has been most rewarding is seeing just the inspiration that I draw from our team. They have committed in this. I mean, everyone is in the same boat, right? They're equally challenged with childcare, with anxiety from sick family members, from being caregivers, and still having to deliver on this such a critical moment for the business and this in this mission-driven challenge. And so I've drawn a lot of inspiration from them. We have moved, as you mentioned, to being remote, and that has, I think, created real opportunity as well. I saw a quote yesterday from a colleague and friend that said, I've hired 2 C-level executives. I've never met them. And despite all of the brainwashing of the last decade of my career, it just doesn't matter. And I very much resonate with that sentiment. I've hired multiple direct reports now, where it's really changed how I think about talent, how I evaluate talent, what matters in adding value in our business. And so I'm hopeful that that allows us to be an innovative workforce of the future. It allows us to build even more diversity into our business by being flexible on location. And I think that this will fundamentally change the American workforce. And I'm actually really excited about that and hoping that we can be a leader in that in healthcare.
Speaking of hiring, I do see a question in the stream from Nora who wants to know, you are hiring, it says that in the headline of your LinkedIn profile right now. She wants to know, what positions are you hiring for right now, and kind of what attributes are you looking for in the terms of people that you're adding to the team? You had an interview right before this, right?
I did, yes. I'm trying to spend as much time as possible on recruiting. It's maybe my most important part of my job as CEO. And interestingly, in March, we actually, like many businesses, not knowing what the response to EveryWell's core business would be, since it is a consumer-driven business, we went on a hiring freeze and just said, we're just going to wait it out a little bit. And ultimately, as I mentioned, our consumer business has also grown exponentially, as has our enterprise business, as has our response to COVID-19. And so as a result, we are almost doubling our workforce. We expect to be just under 200 people by the end of the year. And that requires really rethinking such important hiring practices around recruiting, onboarding, experience building, training. And so that's really what we're in the thick of right now, is how do we learn to do that in this new remote environment and do it really well. So we are hiring across all teams and all functions in all levels. Almost every team is adding resources. As I mentioned, we are based in Austin, but most of these roles are not location dependent, or they are delayed relocation. And so our attributes and our core values, they really center on being energized by challenges, being transparent, and using data to make good decisions. And I think that ultimately we put our customers at the front of everything we do. And those 3 values, we fight for our customers every day and climb that mountain to make healthcare better for them. And that's a challenge that you have to be motivated by. And then you may really love an opportunity to be at EveryWell. Please feel free to apply. We are definitely hiring. I always have that on my LinkedIn profile, but now more than ever.
And you mentioned doubling your team amid this shakeup in terms of how the workplace operates remotely, not remotely. What are the trends coming out of this pandemic that you hope will stick in terms of how you operate your teams and also operate your business, and more broadly, helping workers all across America kind of have a more flexible, say, relationship with work?
There's a few. I think we actually have an on-site facility in Dallas, a manufacturing facility that worked through the pandemic. And one of the first immediate decisions we made was to hire a full-time childcare provider. And I think that especially as I look at gender disparities and how women have been disproportionately impacted in the pandemic, not to mention women of color, I'm hopeful that we are able to think differently about how we support both childcare and family needs post-COVID. I will be upfront, and we have been really open with our team that it has been a higher workload than ever being remote. And so one of my challenges is also how can we help people put some of those natural boundaries in place that happen when you're in an office environment. We need to think differently about how we create that remotely as well. And then more broadly, I'm excited to be able to hire the best and the brightest by looking outside of just our insular circles and recruiting from the same companies here in Austin. And I think that is what will really enable us and many companies post-pandemic to build world-class teams and to build diverse and inclusive teams as well. You're just able to draw from a much bigger pool of talent. And I think that can only benefit tech companies especially and startups.
Mm-hmm. I'm seeing some members in the stream agree with you. Alfred says, taking care of children, working from home, and running a company all at the same time is not easy. Susan says, this is awesome. I saw you on Shark Tank. Hi, Susan. Hi, Alfred. Thanks for joining us. Julia, speaking of Shark Tank, there's absolutely no way that when you stepped out onto that stage, you knew that you'd be leading this company through a global pandemic. But in terms of what's been the biggest surprise since you stepped foot onto Shark Tank, got that yes, and now are where you are right now with the company?
Yes, Shark Tank is still the number one question. I had a tremendously positive experience on the show. I'm a huge fan of both the message and the show, as well as what it did for EveryWell. It gave us a platform to educate Americans on what home testing was about several years ago. But certainly, in partnering with Lori Grenier, this certainly did not come up as something we would be managing through. However, I think that at many points in EveryWell's history, we have had moments of decision, critical moments, critical inflection points. And Shark Tank was one of those when we were less than 20 people. I think we were 13 full-time people, and we were airing on a show that we knew would double our business overnight. And so at a very different moment and for very different reasons and different scale, we still had to make those same choices, right? We still had to choose as a team how we were going to respond to this moment. And I very much see similarities with those decisions around scaling as we are scaling now as well, just in a different quantity and different stakes.
Mm. And when we talk about critical moments and inflection points, some of them are just upon you. And with EveryWell right now, we're getting to the point where a lot of people are starting to nervously talk about a second wave in cases, even though it's important to note across lots of states, incidents are still rising. What does that second wave look like for you, and how are you preparing your teams?
Yeah, I mean, we had a 2-hour conversation on this exact topic yesterday with our scientific advisory board, who are largely practicing clinicians or executives of hospitals, et cetera. And many of them said it is really about individual states' responses and community responses to the first wave. We're sitting here in Austin, Texas, and Texas is currently a hotspot, and we're seeing that in the numbers as well. And yet in the Northeast, which is largely still fairly locked down, you're seeing cases relatively flat. And so unfortunately, we believe that there will continue to be not just waves, but really these ebbs and flows of spikes as communities open up and then make decisions around mask requirements, returning to work, restaurants, indoor locations, et cetera. And it will look different based on each community's rules and regulations. But this is not to be a pessimist, but the facts and the science are that the virus is here to stay, and every person needs to do their part in protecting themselves, their colleagues, their loved ones, sanitizing, cleaning, washing your hands, don't touch your face, and wearing a mask. I think those are the top things you can do, even as people do need to get back to work and we need to keep the economy going.
And speaking of just the ebbs and flows and the uncertainty around when the spikes will happen, where they'll happen, did you see any panic buying when the pandemic first started of the in-home tests? And are you anticipating another wave of that as cases continue to rise across the country?
It's something we were really watching for and had safeguards in place at EveryWell when we first launched the test. One, we didn't announce it. We made it available, but we wanted to understand behavior before we broadly announced it at the end of May. We also restricted to one test per household to ensure that we understood inventory usage. And if you have a positive in one household, there's somewhat of a presumed positive if there's other symptoms. And then we also tracked closely how people were buying the tests and sending it back. Those are all things that we already track. And so I'm pleased to say we did not see that behavior by and large. On the other hand, it is important that people are able to have access to multiple tests. And that's one thing we're learning. So for example, if you use an EveryWell test and you have a positive diagnosis, we need you to be able to get to 2 or so more tests to then have your negative test, especially if you're using it for a return to work program. So those are some of the tweaks that we're looking at making is how can our physician network better kind of pace out these tests for people who do really need sequential testing. But I was pleased that I think we're seeing a broader community response around what is best for the country and social good in managing the virus when people know that there's limited capacity. So we really aren't seeing that hoarding behavior.
Well, Julia, you are so in the thick of it right now, responding to every development of the crisis. But before I let you go, is there a possibility we can zoom out a little bit? What are the trends in healthcare that you are hoping are going to last beyond this pandemic as we get to a state of, I don't even want to call it normalcy, if this normal even exists anymore, but coming out of this, what are you hoping healthcare will look like?
Fantastic question. I believe the theme here is that healthcare services will be moving hyperlocal and into the home. What that means is telemedicine is here to stay in a big way. Drug delivery to your doorstep, here to stay. Testing, here to stay at your home. And I think that everything that can be conducted in your own ecosystem of care that you coordinate as a consumer will only continue to be part of the new normal. I suspect most physicians will have to adjust, and they already have been. I also believe that you will see tremendous pace around changing and permanent change of legislation and transparency of pricing. We've seen a lot of progress already with COVID-19 pricing testing coverage. I would love to see that in a more cohesive and broad way across healthcare. Pricing transparency continues to be a major problem, and we've clearly seen it doesn't have to be. And so I would love to see that take hold in other areas.
Mm-hmm. Well, Julia, thank you so much for all the work you're doing and for sharing your insights on Business Unusual. I know I speak for the stream when I say I've learned a lot, and so have the members, and we look forward to talking to you soon.
Thanks for having me, Caroline.
That was Julia Cheek. She's the founder and CEO of EveryWell, talking about pivoting her startup to come up with solutions to the COVID-19 crisis. This is Business Unusual, a live show brought to you by the LinkedIn News team, where we're talking as a community about the changing nature of work every weekday at 12 Eastern from the LinkedIn News page. Tomorrow, my colleague Susie Jackson will be back with you to talk with food leaders about the supply and demand challenges of bringing food to your doorstep in many cases and to help communities in need. It's a conversation that you don't want to miss. It's going to be tomorrow at 12 Eastern on the LinkedIn News page. I'm Caroline Fairchild. Thank you so much for joining us.